So this is a manual muscle test for the levator scapulae. This is in charge of scapular elevation and adduction, which means it helps us to bring our arm in. So this is a little bit more complicated. So you're going to have the patient tilt their head towards the side, right? Is that okay?
Yeah.
Right? And this is something you have to be careful with. For a lot of patients who are coming in, especially with neck pain or shoulder pain, you know, this type of lateral flexion may be challenging for them. So make sure that that's not too uncomfortable. So you want to get them is about close to 30 to 40 degrees bent as you can, but you don't want it to be too uncomfortable. So we'll have you bend just a little more. Is that okay?
Yeah.
All right. And then you're going to actually rotate slightly away from the side being tested. Again, like the earlier tests, I'm going to be stabilizing this shoulder, and I'm going to be watching for the scapula weakening to see if it internally rotates. So if the levator scapula is weak, this is going to rotate internally, okay? And so, and that's the superior medial angle here, right? You'll see that kind of pull inwards, right? Because the levator scapula come down, they attach the cervicals, the lower cervicals, and then they attach along the inside medial edge of the scapula and a little bit on the top, like sort of around where small intestine 13 is, right? So they come this way, all right? So again, we're gonna have the arm in 90 degrees, right? With a little bit of, actually slightly more adducted, right? Adducted, all right? And again, I'm gonna have my hand over small intestine 3, stabilizing here. Let's bend your bend your head this way a little bit. There we go. And I'm gonna pull out, and you resist, and resist, and resist, and resist. Okay, so here's again the medial, superior medial angle. So watch right there, and resist, and resist, and resist. Now, one of the things you can do is if someone has any little bit of hair on their back or any other features like moles or little spots, you can also keep an eye on that to see if the skin and those markers like pull inwards a little bit. But his is strong, so resist, and resist, and resist. That's the levator scapula.